Hello. This video is on Chapter 28, the female reproductive system, and we're going to talk about the uterine cycle or the menstrual cycle. And this cycle corresponds and correlates with the ovarian cycle. The ovarian cycle was 28 days long. Day 1 of the ovarian cycle began when those primordial follicles started to develop. And then by day 14, the secondary oocyte ovulated into the pelvic cavity. And then by day 28, the corpus luteum degenerated into the corpus albicans if the secondary oocyte was not fertilized. The estrogens and progestins that are secreted from the follicle cells and the corpus luteum in the ovary have a lot to do with what goes on in the uterus. So before we get started on the uterine cycle, let's just go back and take a look at the ovarian cycle again and look at the hormones. So first of all, we have FSH. FSH is released from the anterior lobe of the pituitary. FSH then causes the primordial follicles to start developing into primary follicles. The follicle cells, called the granulosa cells, along with the cells of the stroma of the ovary called thecal cells, they start to produce estrogen. As the follicle gets bigger and becomes a secondary follicle and then a tertiary follicle, the levels of estrogen increase because the number of cells are increasing that produce estrogen. When the luteinizing hormone, or LH, gets released from the anterior lobe of the pituitary, it will initiate meiosis I to complete, and the primary oocyte will then become a secondary oocyte. As the levels of LH increase higher and LH becomes very high, that will trigger the ovulation of the secondary oocyte from the ovary. The secondary oocyte gets released into the pelvic cavity, but there are still some of the follicle cells that remain in the ovary. Those follicle cells then will produce a structure called the corpus luteum. The corpus luteum is an endocrine structure that releases the hormone progesterone. It also continues to release small amounts of the hormone estrogen. If fertilization occurs, the corpus luteum will stay intact and will continue producing progesterone and estrogen until the placenta is formed. But if fertilization does not occur, then the corpus luteum will degenerate into a scar tissue that's called the corpus albicans. When the corpus albicans is formed, then estrogen levels and progesterone levels will plummet because the corpus albicans does not have the ability to secrete those hormones. The corpus luteum begins to form on day 15, the day after ovulation occurs. The corpus luteum will stay intact until around day 26, and if the secondary oocyte is not fertilized, then the corpus luteum will degenerate into the corpus albicans around day 26. On day 28, the ovarian cycle ends, and the very next day will be day 1 when a new ovarian cycle will begin. Now you know where estrogen and progesterone comes from, and now we're going to talk about how estrogen and progesterone controls the uterine cycle. The typical uterine cycle is a 28-day cycle, just like the ovarian cycle. 28 days is a typical uterine cycle, but it can vary from female to female. The cycle begins on day 1 with the onset of menstruation. Menstruation is also called menses. It's the destruction of the functional layer of the endometrium. During the first phase, called menses, the functional layer of the endometrium will be destroyed, and blood and tissues will be eliminated from the body of the female through the vaginal canal. In layman's terms, this is usually called a female's period. The functional layer of the uterus consists of glands and blood vessels and tissues, and this is what gets sloughed off or shed during the menstrual phase. There is another layer in the uterus called the basal layer, and the basal layer survives menstruation, and it won't be shed during the menstrual phase. The menstrual phase can last anywhere from 1 to 7 days. This means the female will bleed for 1 day up to 7 days. This is usually pretty consistent for the female. She'll bleed the same number of days each month, usually, but any of that range is normal. Bleeding for 1 day is normal, if that's what she always does. Bleeding for 7 days is normal, if that's what she always does. The menstrual phase is triggered by the plummeting of estrogens and progesterone. Remember, that occurred as the corpus luteum was degenerated into the corpus albicans, and estrogen levels and progesterone levels plummeted, and then that's going to trigger the menstrual phase to begin. Progesterone was the hormone that was keeping that functional layer intact in the uterine cycle. So as soon as progesterone levels plummet, then the functional layer of the endometrium can no longer be sustained and it will shed. The next phase of the menstrual cycle or the uterine cycle is called the proliferative phase. During the proliferative phase, the functional layer is restored in the endometrium. Glands are produced, blood is supplied to the area, and the cells of the tissue proliferate and multiply. The endometrial layer gets thicker. This phase corresponds to the follicular phase of the ovary. Remember that during the follicular phase of the ovary, the follicle cells are developing, and as they develop, they start to secrete estrogens. So it's estrogen that makes the functional layer of the uterus thicker. The proliferative phase is going to continue until ovulation, which is day 14. At day 14, ovulation occurs in the ovary, and then the follicle cells become the corpus luteum, and at that time estrogen levels fall. So the proliferative phase ends and the endometrium doesn't get any thicker. As the proliferative phase ends on day 14, the next phase begins. The next phase is called the secretory phase. During the secretory phase, the endometrial glands enlarge and they start secreting at a faster rate, and the arteries of the uterine walls start to elongate. And these changes are stimulated by the progestins from the corpus luteum. So the main progestin is the progesterone. It's also stimulated by the estrogen that's released from the corpus luteum because there is still a small amount of estrogen being released from the corpus luteum. The secretory phase begins at the time of ovulation, and it will persist as long as the corpus luteum remains intact and is secreting progesterone and estrogen. The activities of this secretory phase are going to peak at about 12 days after ovulation, which is day 26. If fertilization hasn't occurred, then the corpus luteum degenerates to the corpus albicans, and progesterone and estrogen levels decline. As those two hormones decline, then the glandular activity in that functional layer declines, and then the uterine cycle ends at day 28, and then a new cycle will begin the next day on day 1 with menses. The whole secretory phase lasts about 14 days. Let's look at some hormones. The ovarian cycle in the female begins when the hypothalamus begins to secrete gonadotropic releasing hormone. Gonadotropic releasing hormone stimulates the release of follicle-stimulating hormone from the anterior lobe of the pituitary early in the ovarian cycle. FSH is released from the anterior pituitary and targets the ovary. In the ovary, it stimulates the follicular phase in oogenesis. The follicle cells in the follicular stage start to release estrogens. Estrogens cause bone and muscle growth, stimulate the accessory glands and organs, stimulate secondary sex characteristics, and stimulate the growth of the endometrial layer of the uterus. As more and more follicles are being produced, more and more estrogens are being produced. The high levels of estrogen trigger the ovary to release the hormone inhibin. Inhibin then inhibits the follicle-stimulating hormone. This will prevent other follicles from developing. In lower levels of estrogen, which occur before day 10 of the ovarian cycle, the estrogen levels will inhibit luteinizing hormone secretion. But after day 10, when the estrogen levels rise sharply, the luteinizing hormone production and secretion will actually be stimulated. As the production and secretion of luteinizing hormone increases, the completion of meiosis I will occur, leading to a secondary oocyte from the primary oocyte. At day 14, luteinizing hormone is secreted in massive amounts, and this leads to ovulation. Luteinizing hormone also causes the corpus luteum formation from the remaining follicle cells after ovulation. The corpus luteum then starts to secrete progesterone, and the cells secrete less estrogen than before. As the progesterone levels rise and the estrogen levels fall, the production of gonadotropic releasing hormone declines. If no pregnancy occurs, the corpus luteum degenerates into the corpus albicans. At that time, the corpus albicans can no longer produce progesterone and estrogens, and so the levels of progesterone and estrogens decrease sharply. The falling levels of progesterone and estrogen trigger the hypothalamus to start releasing gonadotropic releasing hormone, and the ovarian cycle begins again at day 1. I want to go over a couple of lifespan changes that a girl goes through. So a girl can start her period anytime between the ages of 8 and 15. Most of the time, the first period, which is called the menarche, starts about 2 years after the breasts first start to develop. If a girl has not had her first period by age 15, or if it's been more than 2 to 3 years since breast growth started, then her menstrual cycles have been delayed. She'll continue through her reproductive life having ovarian and uterine cycles averaging 28 days until she reaches the age of 45 to 55. At this time, menopause occurs. This is the time that ovulation and menstruation stop. If menopause occurs before the age of 40, that's considered premature menopause. Oftentimes, perimenopause will occur prior to menopause. This is when she starts to have irregular ovarian and uterine cycles. She might not ovulate every month, and she might not have a period every month. In contrast, the male will start to have declining levels of testosterone between the ages of 50 and 60, and this is called the male climacteric. Okay, this ends our second video on the female reproductive system, so we will see you next time.